Hello everyone. I'd like to welcome you all for our presentation on COVID-19 third wave and the way forward. We are Restoration Healthcare, and with partnership with Adventist COVID Care, we have taken up this initiative to help give you a message on the COVID-19 pandemic. All right, just a second. Okay, the COVID-19 pandemic has taken and continues to take a heavy toll on individuals, families, and entire countries dealing with the coronavirus. It's been over a year since the pandemic started, over a year since most of us have been working from home, over a year since we've been wearing masks, over a year staying 6 feet apart, and over a year since we've lost loved ones to the pandemic. Globally, as of yesterday, July 20, there have been more than 190 million confirmed cases of COVID-19, including about 4 million deaths reported to the World Health Organization. And in India, from 3rd January 2020 to 20 July to 2021, there have been about 31 million cases confirmed in India and about over 400,000 deaths. These are reports by the World Health Organization. But since the pandemic began, we have learned and we are still learning a lot about the virus. Just yesterday, the news came up from the Indian Council of Medical Research, the ICMR, that about 2/3 of the people in India are seropositive, meaning they have the antibodies for COVID-19 and they have been exposed to COVID-19. But in other words, about 1/3 of the population is still vulnerable, about 400 million people in India. So we really need to be vigilant on how we can go about being careful during this pandemic. The Delta variant has had a huge toll in India, and it causes many different kinds of symptoms, which is not common for COVID, and we need to be vigilant about the risk factors. For this evening's presentation, we have two distinguished guests with us. We have Dr. King Harold Kisku and Dr. Samuel George Hanstack, who have accepted our invitation and have come up to help us with giving the right message to you all. We'll have our first presentation with by Dr. King Kisku. He is a professor and the head of the Pulmonary Medicine Department at the Pondicherry Institute of Medical Sciences. And he'll be talking about the epidemiology, risk factors, and about persistent COVID symptoms. Your time is now, Dr. Kisku. You can go ahead with your presentation.
Good evening, everyone. I hope I'm audible and visible.
Yes, you are, sir. Yes.
Okay. Thank you all for joining in this presentation, and good evening to all of you. At the outset, I would like to thank the restoration team for giving me this platform and allowing us to share some of our information that we have on COVID. And also I'd like to congratulate the restoration team for the good work they're doing in promoting healthy lifestyle and also creating awareness on COVID. The topic for today's discussion, the title for today's webinar is entitled The Third Wave, COVID-19, the Third Wave, and the way forward. So the question on everybody's mind is, will there be a third wave, number one? And if there is going to be a third wave, when? And that is what I'd like to address, if some of the issues that we have on the possibility of a third wave. Now, if you look at the slide, this is the COVID timeline that in the world. Okay, we saw the first case that was reported on December 31st, 2019. On March 11th, the WHO declared COVID as a pandemic. By mid-March, there were over 1 million cases worldwide. And by by April 2nd, there were also about 40 some odd deaths. By August, the Russian country started using the Sputnik vaccine, even before they got the data on the phase 3 trials. And in India, we started having the peak by September, and by January we saw this peak coming down, and by March the pandemic continued worldwide, but in India there was a sort of respite, and we saw a massive second wave in April, May. Looking at the COVID timeline in India, again on 30th January, the first cases were reported in India, 3 medical students in Kerala who had returned from China. And on 29th March, there was a nationwide lockdown to curb the spread of COVID. In September, we kind of peaked, the first peak, and this did not cross 1 lakh cases a day. It was around 90,000 cases per day. And on January 16th, there was a launch of the vaccination drive, and the cases started coming down. And that is the time, there was a sense of jubilation and victory that we have overcome COVID in India. The relaxations were lifted up, and restrictions were lifted up, and more relaxations were allowed. And there were festivals and festivities, elections. And then in March, we began a massive second wave, which with over 4 lakh cases a day, and almost 4,000 deaths per day. And that is what we saw in our country. Now, this is the graph. If you look, the first wave peaked around September and tided off over by December, January. But even in the first wave, we did not really cross 1 lakh cases per day. It was around 99 cases, 19 to 99,000 per day. But the second wave was steep and sharp. There was a rapid rise in the cases, and it crossed almost 4 lakh cases per day, and the deaths also went up to more than 4,000 per day. This was really steep and sharp, and also kind of rapidly started declining after a couple of months. This second wave really took us all by surprise. The hospitals and the resources were all overwhelmed. There was shortage of of beds, of oxygen, and reports of people not able to find hospital beds, ICU beds, dying in the ambulances, and all kinds of thing happened. Although we had some time to prepare after the first wave, but the second wave really took us all by surprise. And now, as a precaution, as the second wave is kind of coming down, there is now the thought of a third wave. But this pattern was not uniform throughout the country. You see the orange line over here, that is the first wave and the second wave in India. But if you look at Delhi, there were almost four waves. There was one wave in mid-June, a second wave in mid-September, another wave around December, and then the massive fourth wave. So this had its own geographical variations in different parts of the country. Now, if we need to learn from history, and if we look at the Spanish flu pandemic in 1918 and later, we see that there were three waves. The flu pandemic was occurred in three waves. Now, the flu is also a very similar respiratory virus, the influenza. So we can learn from the tale of the flu pandemic. And there was a small first wave, and then a large second wave, and then a third wave that came in. And according to what we know from epidemiology is, till there is a buildup of herd immunity of more than 80 to 85%, it's only then the pandemic really starts to end. And as of now, we just got the report from the fourth sero survey, which Dr. Sarjan was just speaking about. This sero survey that was released in the media, we haven't seen the published report from ICMR yet, but this sero survey suggests that in India, the antibody, the percentage of people who have antibodies 6 years and above is around 67%. So that is encouraging. That is, we are reaching a level where, because of herd immunity, we can start seeing a decline in cases. But that also leaves one third of the population still vulnerable. I just got a feedback that my voice is not audible. Is that true?
It's fine, sir.
It is fine. Yeah, it is audible.
Okay. Thank you. Then I'll
maybe
just
let them check the earphone or some. Yeah, others can check that.
Yeah, so the report of the fourth sero survey is kind of encouraging, and it is looking that we may reach the point of herd immunity soon, especially with the vaccination. So almost 85% of the population needs to have the antibodies either by natural infection or by vaccination for herd immunity to take control and the pandemic to start dying down. Now, based on that, will we have a third wave in India? Now, what are the likely causes for the second wave? These are some of the reasons that were put forward: relaxation of COVID-19 precautions, and opening up of schools, theater, gyms, public gatherings, laxity among the public, and also possibility of the arrival of a mutant strain which was more infectious. Looking at the numbers, we are just behind America and Brazil in terms of numbers, almost 3 crore cases. And in terms of deaths, around 4 lakh deaths, just behind America, the number 2 in that. So going by the reports that we are getting in now, that we can be certain that we are on the declining phase of the second wave. We are declining on the second wave. The numbers are coming down. Just yesterday, I think it was 43,000. A day before, it was 30,000 total number of cases. So it looks like we are in the declining phase of the second wave. But unlike the euphoria that was present after the first wave, where we were celebrating that we have overcome COVID and we have conquered COVID, and we have now the pandemic is going to end. This time, that kind of feeling is not there, and we are being geared and we are being told that there could be a possible third wave, and understandably so, because that is what history tells us. And if we have to learn from the lessons of the flu pandemic a century back, we could expect a third wave. But going by the serosurveillance in our country, 67% antibody levels is good, nearing the target of 75-80% of herd immunity. But there are still many parts of the country, like those in the southern hemispheres, especially the African countries and Australia, New Zealand. These are countries where, again, the antibody levels are very low. We haven't had major outbreaks there. So there are a significant number of population that are still vulnerable. And this is the data from the European countries. Looks like this is the end of the second wave, and there has been an increasing number of cases, especially in UK, Spain, Portugal, Netherlands, Greece, Indonesia. And the predominant strain that is driving this increase in case is the Delta strain. But these increase in numbers have not resulted in an increase in hospitalizations as of now, as yet. So what we understand is, though there is an increase in number of cases, there is no increase in hospitalization. So we think that probably the number of cases are just mild at the moment. This is again from Europe at the end of second wave, and there has been a peaking third wave over there in terms of number of cases, but not in terms of hospitalization. So again, so coming to the question that will we have a third wave in India? Maybe, maybe not. We may have a third wave going by history of the previous pandemic and looking at the trends in the European countries. At the same time, this third wave may not be that dreadful, because what we are seeing in the UK is, although number of cases are increasing, the number of hospitalizations and serious cases are not so high. So I will kind of leave it at that. I would not like to make any predictions, We just have to wait and watch. Now the question is, there was another question: is will the third wave affect more children? Now this question has come up because of the concern that children have been vulnerable and the age group below 18 has not been vaccinated. But again, going by the serosurveillance data, which showed more than 2/3 of people above the age of 6 have antibodies to the coronavirus, it looks like children, even though they have not been targeted in the first and second wave, probably have developed antibodies to the coronavirus. So again, it is again a speculation, a theory, which we have to wait and watch. But the good news is what we have learned from the first wave and from the second wave is that even though children were infected, we did have children that were infected. Most of them, almost all of them, I would say, just got away with mild illness, just had a fever for a few days and got and improved. And we didn't see any child really becoming sick. Of course, there was a few reports, sporadic cases here and there where a few children did get sick, but majority of the patients, in fact, almost all of the children did not have serious illness in the first and the second wave. Now, coming to what we have learned from about this virus in the first and second. So I will leave the third wave at that without making too many predictions. And we just have to wait and watch as to what could happen in the coming days. Now, what we have learned from this epidemic and this illness, SARS-CoV-2 infection, is the first few days is mainly the viral infection, and then later on is the inflammatory response of the individual or the host individual response. And what we have learned is it is not the infection which makes the person sick or which is fatal, but it is the inflammatory response, the hyperinflammatory response that eventually causes organ damage and organ system and death. There have been a few treatment options available in the initial phase, that is in the initial phase of infection, antiviral drugs, but we really don't know whether they work or not, these antiviral drugs and some antibiotics. In the inflammatory phase, there has been some role of using anti-inflammatory medicines like steroids, which has shown to improve survival. Now, the question is, okay, there are people who get away with just mild illness, and then there are people who have severe illness and who can also succumb to this disease. And what we know is it's mainly this inflammatory phase or this inflammatory response that eventually makes a person sick and causes fatal outcomes. So what are these conditions that can cause this? What are these conditions that drive this pro-inflammatory states? We know that those who have these comorbidities, okay, those who have associated diseases like hypertension, diabetes, heart diseases, kidney diseases, chronic lung diseases, or neurological conditions, these are the patients that fuel the inflammatory response, that leads to organ damage and death. But those who have got a very good anti-inflammatory response, they are the ones who probably are asymptomatic, just develop mild symptoms, and they recover very well. These are some molecules that trigger off an anti-inflammatory response, and these are some molecules that trigger off a pro-inflammatory response. Now, what I have seen personally is a predominantly what drives an anti-inflammatory responses or what drives pro-inflammatory responses is basically deals with the lifestyle choices that we make. As I said, all these lifestyle diseases like hypertension, diabetes, heart diseases, and cholesterol, kidney diseases, these are ones that drives pro-inflammatory responses that eventually makes a person very, very sick. Apart from these, even our lifestyle choices that we make, okay, take for example, okay, exercise or healthy diet. These are things that produces or drives anti-inflammatory molecules in our body. The more wholesome food that we eat, the more muscle activity that we do, or physical activity that we do, they produce these anti-inflammatory molecules. More refined foods that we eat, more sugary foods that we eat, more and less of physical activity drives and fuels pro-inflammatory responses. And that is what I could kind of understand as to why some patients, okay, eventually have this hyperinflammatory states and develop severe cytokine storm and eventually die, whereas some who just have mild illness and get away with it. It is all to do with how we have how our body responds in an anti-inflammatory way or in a pro-inflammatory way. If we see this slide, if once a person is exposed to COVID, some of them don't get infection at all. Those who get infection, almost 40% are asymptomatic. And this is to do with, again, individual immune response. And those who become symptomatic, almost 80% of them have mild symptoms, and they recover well, as I say, because of probably a good anti-inflammatory response in their body. Whereas a few of them, 20% of them, develop severe symptoms, and around 1 to 2% of them eventually succumb to their illness because of this cytokine storm, multi-organ failure, and even death. And these are the ones who actually die of hyperinflammation and a severe inflammatory response that eventually cause organ damage, predominantly the lungs, and also inflammation in the blood vessels leading to blood clots, and also inflammation in the other organs, kidneys, leading to renal failure or kidney failure. And once multiple organs starts failing, it becomes very, very difficult. The chances of survival becomes very poor. And so even this is the guidelines that we doctors have been given by the ministry of triaging the patients into mild, moderate, and severe cases. Mild and moderate, we have been given specific guidelines how to treat them. Severe cases, we have been given specific guidelines how to treat them. And most of these patients who have mild, moderate disease do well. Severe patients, the mortality rates are quite high. These are the treatment options of those who eventually get hospitalized. Mainly, it's supportive treatment. Antivirals, we don't know whether they work or not. There have been conflicting reports. We also use blood thinners to prevent blood clots. Oxygen is the mainstay. Some of them may require high oxygen level, high oxygen support, including ventilator. And as I said earlier, anti-inflammatory treatment with steroids does help in those who have this hyperinflammation states. This is the data of patients who have died with COVID, almost all of them had one or more comorbidities like hypertension, diabetes, hypertension being the leading one, almost 55%, diabetes around 35%, coronary artery disease, hyperlipidemia, and renal disease, neurological conditions, lung conditions, cancers, heart conditions. Most of these patients who died had one or more of these diseases. And this is also deaths among the age-wise distribution. Those 85 and above, those who had COVID had almost a 30% mortality rate, and those in the higher age groups, 65 and above, had higher. But what is of concern over here, we had death rates even in those who are younger, in those in 25 to 30 and in this age group, which is very, very sad, and it is very, very disheartening to see. Though the numbers are less, but there were deaths even in this age group, probably again, because of a hyperinflammatory response in these patients, which we don't know what exactly drives it. Okay, we can speculate that it could be maybe poor lifestyles and things related to that, but there were deaths even in this age group. Just this slide about the variants of this thing, or the viruses. There was a question about what about the variants. Yes, I mean, this is a natural history for any viral infection. But the virus, if it has to survive, has to mutate and has to change its structure to avoid the antibodies that the people are building against them. Now, we have seen this in the flu. Every year, the virus changes its antigenic structure, and it's not the same virus that comes every year in the flu. And similarly, in COVID, we initially had the alpha variant, which was isolated in UK. That was the predominant strain during the first wave. And then the beta variant that was isolated in South Africa. Then there was also another variant, the gamma variant, which was isolated in Japan and Brazil. And now this variant, the Delta variant, which was first isolated in India, is the predominant strain that is causing the worldwide pandemic. Now, the vaccines that were initially made was against the coronavirus. Of course, all of this are still belong to the coronavirus family. So the vaccine efficacy may not be 100% in all, as the viruses finds ways to mutate and to escape the antibodies, but still there could be some protective effect of the vaccine, even though the virus does mutate, but maybe a lower protection than what was there initially for the alpha variant. I just wanted to address this this problem of the post-COVID symptoms or the long COVID symptoms. We have seen many patients coming with this post-COVID symptoms. We have a regular outpatient clinic for these patients, and most of the symptoms are persisting symptoms that they had during the COVID time, like tiredness, breathlessness, joint pains, chest pain, cough. There have been also some symptoms like hair loss and a sore throat, giddiness, body pain, etc. Now, these symptoms are mainly due to a persisting amount of inflammation, as I said earlier about the COVID disease. This inflammation persists in the muscles, in the joints, in the blood vessels, in the nerves, which drives these long COVID symptoms. And generally we have seen patients even 3 months or even 6 months after their illness still having these post-COVID symptoms, still having these symptoms. We have also seen patients having scars in their lungs, bad scars in their lungs. When the first wave and the second wave came, we saw many of these patients with very, very badly scarred lungs, and we didn't know what to do. Many of them, a few of them, even went for lung transplants, as we as we uh, as we read and heard about it. But what we have learned that these scars, even if they are so bad, over the period of 3 to 6 months, does get better, and they only need supportive treatment, and they may need a prolonged oxygen stay or a prolonged oxygen requirement even when they go home. But these lung scars do improve over a period of time. Very, very few of them have these scars which are kind of permanent, uh, like like the scars that we see after tuberculosis, or the scars that we see after other lung infections, which kind of are permanent. But what we have seen of COVID is most of the scars resolve over a period of time, even without medications. And right now, this is what we follow about treating these long COVID symptoms. Okay, and generally, basically, we need to plan conditioning. They have been deconditioned after their illness for a long duration of time, and a lot of conditioning is required. They need to plan and pace their activities, and also prioritize what are things to be done. Sleep is very important. Sleep is a very good, anti-inflammatory activity, and the better sleep that you get promotes, helps in settling this persistent inflammation. So it is important to improve sleep hygiene, sleep physiotherapy, rehabilitation, as I said earlier, also muscle activity, physical activity, all promotes anti-inflammatory molecules which can bring down this persistent inflammation and long COVID symptoms. And some of these patients also would need, some kind of a psychological support and some professional help, because brain fogging, depression, anxiety, these are some of the common problems, that poor concentration. These are some of the problems that persists even after having this COVID. And generally 3 to 6 months of rehabilitation, counseling, and conditioning of the body, which would lead to improvement of the symptoms. So I would like to end with this slide. Yes, healthy lifestyle does drive anti-inflammatory state, which is so very important that we have seen this in COVID, and I would say this is the most important thing of building your immunity, of 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 seeing that your body does have a anti-inflammatory response, and poor lifestyles are the one that drives a hyper-inflammatory response that causes severe COVID diseases, that causes COVID deaths, and also causes long COVID symptoms. So it is basically a lot to do with the choices that we make of how we live our lifestyle. I would end my presentation with that, and thank you very much. And I hand over the time back to Dr. Sarjan.
Thank you, Dr. King, for this very informative presentation on risk factors, what we should do to be careful during this pandemic. It's been really informative, and thank you so much. Our next presentation will be by Dr. Samuel Handstack. He's a professor and head of Department of Medicine, Unit 4 at Christian Medical College, Vellore. He'll be presenting on COVID management and COVID vaccination. The time is yours now, Dr. Samuel.
Thank you, Sajin, and thank you, Dr. King Kisco, for his exquisite presentation. He has actually made my work easy because I don't think so I have much to present. Most of the themes are covered. I think many of the questions that had come up, which has also been touched. So what I would be doing is I will just pause on some of the themes, kind of filling up the gaps that may be there in the COVID. So most likely I'll be going a little fast. Uh, so this is something that we are all familiar with. Uh, uh, COVID is all about what we know and what we don't know, what we understand and what we don't understand. It is really about COVID being confused, saying that we do claim we know, but the truth is that we don't know. So my presentation will be all about this dilemma of what we know, what we claim to know, and what we know. We start off with virus. The first question is virus a living organism or is it not a living organism? This also has been debated about viruses, and this little virus, which is not seen, has created havoc across the globe. And if you have to really understand the virus, it's basically in COVID, we are calling it as RNA and a protein capsule. So in a protein capsule, there's a small strand called RNA, most of you are familiar with, and these constitutes a virus, and it has different parts. The envelope, the membrane proteins, and then you have the spike protein. By this time, most of the common man has become a virologist, knowing all the details with so many presentations, videos, everything going around. So the first dilemma is really to understand, do we really understand viruses, what they are? And that is the first dilemma. Most of our focus is on these spike protein, as most of you would have known and seen in various videos. What really multiplies these viruses are these code of the gene code called RNA. So these two things is what constitutes the virus. And as Dr. King has already covered, there were questions on variants. The variants have gone by the names from the locations. So the first one from UK, Alpha, Beta, Gamma, Delta. And now we have Delta Plus in India that is coming up. As King already mentioned, that if we think we vaccinate everyone and the number of cases comes down, if you are thinking of eradicating COVID, that is not possible, because this small virus, it keeps changing, it shapes its face. And so even if you have a vaccine, it will cover the old variant and there will be a new variant coming, and we will spend the rest of our life chasing this virus, never to be able to get victory over it. So that's the fact that we need to remember. Now, this is the other thing that King has covered on the symptoms. I think the first question that was asked is why some people are asymptomatic. Statistically, roughly about 20 to 30% of people who get the virus do not get symptoms. The 70% who get symptoms, almost 85% gets mild symptom, they stay home, nothing happens to them. It is 15% of the people who become very sick, and out of these 15%, about 3% die. So what we call it as case fatality rate, or the people who have symptoms, the number of people who die is roughly about 3%. If you calculate by the number of people who get infections, it will be about 0.1 or 0.3%. So if you look at those numbers, it doesn't look like very bad that the number of people dying is actually out of 100, only 3 people die. Out of everybody who get infections, it will be 0.1 or 0.3% dying. Doesn't look that bad by absolute numbers. But when we put it together in a population like India, the number of people who are becoming very sick, that is 15% who requires hospitalization, multiplied by populations, it is a big number. and that is what overwhelms our healthcare system, and that is what we saw in the second wave. So if you have to remember that these viruses, like many other viruses, are there, all the viruses continue to stay, they continue to survive by changing their face, and um, any eradication, any attempt to think that we can control or eradicate is a myth. We will never get to eradicate them. So this is something that is going to be there for the rest of our life. As already King mentioned, that the viruses and the host is basically the battle between these two, which determines whether we remain safe, whether we get symptoms, or whether we become very sick or die. So how our body responds to the virus is the whole key that we need to understand. And this is the understanding that we just want to lay down. Now, if you look at um, getting a CT scan has become a kind of a new norm or a new standard. If you have fever, the first thing people want, you want to diagnose COVID, go get a CT scan done and we'll make a diagnosis of COVID. And the amount of CT scans that has been used during this season, interestingly, not one, two, but number of CT scans. So like X-rays, people will be carrying bundles of CT scan. But what we need to understand is that when we look at the CT scans, one thing good about CT scans is it can pick it up things early, but it is not the early presentation that is important. Only if you have symptoms like your saturations falling down is an indications to treat patients. So just because you made a diagnosis of COVID, whether through a PCR test or through a CT scan, doesn't change our management. What really changes our management are some things that we can know without doing necessarily a CT scan. So I think to get off the mind that this is absolutely necessary or this is the diagnostic or we need to have it and keep repeating it is also not the truth. There are situations where we need it to use it discreetly, but to use it for every patient where you have a suspicion is also a kind of a myth that we need to be aware of. And these are very expensive tests where people are so desperate. If they know this is important, they would spend that money. But very few patients out of thousands of patients that we saw here that we did CT, except for a few selective patients. So this is just for information because the general public feel that this is a very important test that should be done for every suspect patients. As King already mentioned that it virtually affects every part of our body. Just to emphasize here, what the virus really does is it enters into your blood circulation. It damages the inside lining of your blood vessel. And once that is damaged, it causes some blood clots to be formed there. When blood clots forms there, the blood circulation to that organ gets reduced, and when you do not have blood supply to a given organ, whether it's a brain, heart, lung, kidneys, that organ is not able to function. So that is the basic mechanism, not just for COVID, for any infection. It affects or damages your blood vessels, cause small clots over here, decreases the blood circulations and thereby damage these organs. And depending on how many organs is damaged, the chances of that person surviving becomes less and less. So that whole process is what is called inflammation, as King mentioned that. Now, there are different ways that we diagnose it. I think by this time, all of you are very familiar with it. Either we are looking at the genes or we are looking at the blood. What both Sajan and King mentioned is seroprevalence. So what that term actually means is when the virus gets into your body, it stimulates our body's defense cells to start developing, increasing in order to kill the virus or remove the virus. Now, these are some cells, and some of these cells secrete certain chemicals, which we call it as antibodies. Now, what is very important for us to understand is two things over here. I would like to point it out because these are some things that people keep coming to us asking. Now, if you come with a suspicion of COVID and you're tested positive, they would like to know whether I have become negative. You have checked is a DNA. As I said, virus is a protein coat with a genetic gene material inside. Inside you have this RNA. So when you test for that, it is positive. We say you have got an infections. When we treat you, your fever comes down, you're ready to go home. What happens when we test you? Now your fever has gone, you're feeling perfectly okay, but when we test, you are still positive. Now the question is, how come I'm feeling okay, my symptoms are gone, why am I positive? You will be positive as long as the virus, whether dead or alive, is it still there? The swab that you put in your nose and you test will still show that genes, which tells you that it is positive. Now that gene will be positive because the virus is there even though it has died, right? So the gene positive does not mean that the virus is still alive. So this is something that we need to understand because people keep checking their PCR of when they are okay, then after 1 week, then after 2 weeks, and they keep coming positive. It will be positive because the dead virus with that gene inside it, when you test it, it turns out to be positive. So positive does not mean that you have a live virus. So we need to understand in which context this test needs to be done to have that. Second is these antibodies that we see happens not immediately, not within the first week. Usually, again, there are two types of antibodies. The one which comes immediately and the second one which comes after some time. If you look at it, so after 2 days, we have an antibody which is called IgM. And after 9 to 11 days, there's another antibody called IgG. Most of the time, we are looking at IgG. So if we do the serology test in a patient who's having fever within 1 week, it will be negative. So antibody being negative does not mean that you do not have a COVID. It just means that this test is not positive during the first 7 to 11 days. It is only positive after the second week. So that just tells you that you had COVID in the past. So serosurveillance or checking these antibodies in a population tells us that they had COVID sometime in the past, and we are just looking at how many people have been exposed to COVID. So there is a role for these antibody tests. It is definitely not done in a patient who has come with fever. What is done is this test when they come acutely with fever and all the symptoms, and this we do it when they come with symptoms. If positive, we say that you have COVID. That's it. We do not need to repeat it to know whether the COVID has finished from our body, because as I mentioned, it can continue to be positive. So just those 2 points on the diagnostic test, and you will realize there are so many types of gene tests, antibody tests, and antigen tests. We are not going into the details. Management has been covered, and this is just to show you at the end of the day, 1.5 years of COVID, these are all the medicines which has been proven by studies to be helpful. If a person presents with a mild symptoms, they are maintaining saturation, we have one remdesivir and some steroid inhaler, only these two medicines. Remdesivir only shows that your fever days can be reduced by 1, 2 or 2 to 3 days. Doesn't change your total outcome. We call as whether you can reduce the death. If you can reduce the death, that means that medicine is good. So this medicine does not reduce death. It only reduces the total duration of your fever days. So PEEP is expensive. Those who cannot afford, we don't give it. Steroid inhaler is something that has come lately, which we give in mild patients. In severe patients, we actually have only 2 medicines. First, anybody whose saturation is less, we give them steroids. If not responding, then we give them what we call as interleukin-6 inhibitors, tocilizumab. So can you imagine? This is all the treatment that you have. If you respond to this, you respond. If you do not, we don't have anything. There are There are more than 50-60 medicines which are on trials. There are lots of medicines that people give in various centers. All of them do not have any scientific basis that it works, but people are desperate, doctors are desperate, patients are desperate, anything given to them, they take it. But this is just to put it on records that these are the only drugs that has been found, clearly found to be helpful. Again, just to tell ourselves the best of what man could do with the amount of knowledge that is there. This is the best that we have come to. Pretty humbling to know and understand this. Now, let us understand what do we mean by prevention. Now, the question is, what do you want to prevent? Obviously, it makes sense to prevent deaths. So to prevent death, what is our strategies? And prevent death is different than preventing COVID infection. You may say, I mean, that sounds pretty contradictory. How can you prevent death without preventing infection? Now, death and infections are two different things that I will be trying to attempt to explain to you. Now, the question is, when will the pandemic stop? It's $1 billion question. Now, reducing death and reducing pandemic, we need to understand these are two concepts which are different. It may sound synonymous, but it is different. What reduces death and what reduces a pandemic, I'll help you to understand what it means. And if our question is, when can we get back to work and do the normal things, going out to restaurants, having food, going out in beaches, visiting people, when will this pandemic stop? It's absolutely very legitimate questions. The other question is, how do we prevent death because of COVID? So these two are not the same thing, and we need to understand that. And I'll just try to explain. King has also touched it. I will just try to expound a little bit further. COVID-19 is like a forest fire. The forest fire begins at one end and it keeps burning the trees of the fire. And as it keeps burning the trees, it keeps progressing, right? Trying to treat COVID-19 with all the medicines that we have is like taking some sticks and brushes and trying to hit the fire. You cannot extinguish it. It doesn't do anything to the pandemic. We are just trying to save lives, but the pandemic is still raging. Now, to prevent COVID deaths, to prevent infection is equal to COVID deaths. I mean, let's take this equation. Prevent infections, you are reducing COVID deaths absolutely fast. How do we do that? Using masks, sanitizers, social distancing by isolation, quarantine, lockdown. We are all familiar with this. But you know what? This will reduce infections and reduce death. Does it stop the pandemic? Actually, no. So preventing infections, death is not equal to preventing pandemic. Now, you may get a little confused. What am I talking about? And this is where the key issue comes in. How to stop pandemic? Only way you can stop pandemic is not to stop infection, but to promote infection. Infect everyone, burn all the trees in the forest fire will stop. Now that sounds a little contradictory or pretty inflammatory, but that's what it is. If you have to stop pandemic, you have to infect everyone. But the key is do it safely. So how do we do it safely? One, by controlling the agent, that is a virus. So how do we infect people with the virus? We vaccinate it. Vaccination means you make the virus safe and less effective so that when you put it into the body, it does not cause severe illness or kill the person. So I modify the agent by vaccination, but the idea is unless you infect everyone, you cannot stop the pandemic. The second thing is you modify the host. And as King already presented, the host means the people who have less risk are the children and young adults and those people who are healthy. So you have two options. Either you modify the virus and put it into the body, or you take the normal virus in a healthy conditions. If we do that, we will spread that infections. If we spread that infection, we will stop the pandemic. So I hope you are able to comprehend that on one side, we want to reduce death by stopping infection or the spread of infections. On the other side, we also have to stop pandemic, and the only way is to spread that infection. So on one side, we are stopping infections. On the other side, we are spreading infection. So as much as it sounds paradoxical, but that is where the fact lies. And so we have these vaccines. All of you would have read about all these things in the news. We're not going to the details. What is the function of vaccine? It's like putting the picture in the police station. Put the picture, and so when the police sees these familiar pictures, they catch hold of them, knowing these are the things. So what we do is we put the picture of the virus inside a body, and when these viruses, when the vaccine is put inside, it's like flashing those pictures to our defense cells. So when they recognize it, anytime the virus enters, they immediately mount a war and clear it off. So that's basically the functions of vaccine. What is the flip side? I have put this picture, right? Now what happens? This person is the same, but you see their face have changed. This lady and this lady are the same, but if you were to see this lady, you won't know it's the same lady. What happened? We have a face off. The virus has changed its appearance. I introduced a vaccine which was looking like this, but the virus changed. And so when this person enters, he doesn't look like a virus. So I don't do anything, but he's a virus. He just changed his face. So that's the story about this virus variants. And so the problem with this virus is it changes its face. So even if I put in a vaccine, that vaccine may not work after some time because the virus would have changed. Now I need to have a new picture of that virus and again introduce it. That is what happens for the influenza vaccine. Every year, people have to be vaccinated with the new strain or the new variant to prevent the episodes of infections for that year. So that virus only works for that year. We don't know what is going to happen for COVID, whether we all will be vaccinated every year again and again. It is for everyone to guess. Now, we have, I won't go into the details of vaccines. Whenever we decide to introduce a vaccine, it goes through 4 phases. We call it as phase 1, 2, and 3, and 4. And so the first phase is to see whether it is safe. So first thing is to introduce it among volunteers to see if it is safe. Second phase is to check whether it works, its efficacy. If we are sure that it is safe, if you are sure that it works means when I put the vaccine, the virus inside, is there enough antibodies that develops? If I put it, we check that. If these two are okay, then we do it for a bigger populations, 1,000 to 5,000 patients to see, is it still safe? Is it still working? And once that is clear, then I get approval to put in these vaccines. Now, normally a vaccine comes into the populations after several years, minimum 5 to 8 years before a vaccine is introduced. This is first time in a history that by the end of a year, we had a vaccine that had an emergency use authorizations and it was used. So technology changed. All these phases were speeded up and introduced because it was a pandemic and people were dying. So that's something very unique about this COVID that we learned. Now, there are different vaccines produced by each countries. Many of you would know it and you can find it out. The vaccines that we are using is the Covishield and the Covaxin. The durations have been changing. I mean, normally between the first and second dose, you have a month gap, 28 days. But for Covishield, they have increased the durations to about 84 days. We are not very clear and sure, but studies are still going on. And so while the studies are going on, different decisions are being taken to decide what should be the space between two vaccines. This is just to show that India is the 4th largest producer of vaccine after China, United States, and Germany, Belgium. So good opportunity for some good business. And this was already shared. Now here I would like you to see is we had this study done in August 2020. The number of people who were exposed to the virus was 7.1%. Exactly 1 year before, 7.1%, and now it is 67.6%. It is not just the vaccine alone, it's a combination of normal infection and the vaccine that has pushed the people who are exposed to COVID from 7 to 67. So this is just a comparison how the number of people. So unless this increases, the rough calculation for herd immunity is 70%. So we are almost there. What herd immunity means is if 70% are exposed, it will protect the 30% from getting viruses or getting severe infections. So, and that is when the pandemic is supposed to slow down and stop. So there's a good possibility that there may not be a third wave, and if it is there, it may be a very small spike, not like the second wave. So, so these are, yeah. Now, something of interest that we may be interested to know. Now, look at the deaths by heart disease. That's the highest. Worldwide, the commonest cause of death is heart disease. The second commonest is cancer. If you look at the total number of deaths caused by COVID in 1 year, it's roughly about 1/3 the death caused by heart disease. Have we announced lockdown? Have we kept people inside the house? Have we stopped people from going into fast food restaurants, having and drinking sugary beverages and eating all the unhealthy food? No. I mean, people still go out and eat what they want to eat and continue to die at the rate of 3 times the number of COVID. So if you were to look at absolute numbers, this is where COVID is, this is where heart disease is. But for this COVID, we have a national and a global response, and we are doing many things. But as King already mentioned, what causes a heart disease? The response is politically quiet. And of course, this is something already tested. So either we modify the agent or the virus, or we modify it. The choice is yours. If you take care of your health, if your body is in good system, your immune system is doing well, there's no reason why you cannot fight any enemy that comes inside. Because today is it COVID, tomorrow it will be something else, day after will be something else. How many vaccines will keep making? How many of these injections will keep working in? But if you have to invest in one thing to build up your health, it is not just preventing COVID, but you will not just be preventing disease or sickness or illness, but you will be promoting health, you'll be promoting happiness, peace, and a sense of well-being in our life. So stay safe. May God bless you. Thank you so much.
Thank you, Dr. Samuel. It's been really enlightening and really helpful presentation on our understanding on COVID-19. Thank you, Dr. King, Dr. Samuel, for your time with us and for your presentations. Right now, we'll be moving on to the question and answer session. We have already sent a form for the questions to be filled, and we have had some questions coming in to all our participants. The first question will be for Dr. King. You already covered this in your presentation, sir, but a little more clarity as to when will the third wave come, and should we really take COVID appropriate precautions?
Yeah, thank you. Yeah, as I said earlier, also third wave is a possibility going by what happened in the last pandemic of the Spanish flu. There were 3 distinct waves at that time. And so that way, the third wave is a possibility. We are almost on the declining phase of a second wave. And there are indications and reports from European countries that there is an increase in so there is a third wave already started in these European countries, although it has not resulted in increased hospitalizations. But we also got this encouraging results from the sero surveillance that we have achieved 67% antibody levels in India. 70% is what generally is the target, and once 70% of the population has developed immunity, the pandemic tends to slow down, or the epidemic tends to slow down. So we are nearly there. So will we have a third wave? We have to wait and watch. Maybe, maybe not. If at all we have, it may be not as large as a second wave. Maybe a small increase in the number of cases. Many of the epidemiologists and all have suggested August end, September may be the time, and you may have a third wave. We have to really wait and watch. I really can't make predictions. We have to, wait and watch.
All right. Thank you, sir. Any input, sir, from Dr. Samuel?
Yeah, I agree with King. I think if it has to happen somewhere around mid or end of August or early part of September, if it has to happen, but most likely, and again, these were predicted before the sero surveillance report came, and sero surveillance is only confirming that the possibility of a major peak would be very, very less likely. And whether we call it as wave or whether it becomes an endemic occurrences of COVID like any other viral infections, we will have to see whether it takes a wave form or it just becomes an endemic, that people who never had it, they'll keep having it in a spread out way, but not like a wave.
Thank you, sir. The next question was a very common question posted by our participants. The question is, will the third wave affect more children than adults? And what precautions can we take for our children? Dr. Samuel, you can go first.
Yeah, as King already mentioned that, so there was a thinking that children may be affected because vaccination was not including them. But again, the sero surveillance reports are changing all those, that even among them, the positivity rate is almost same as the adults. And it is reasonable to believe that because every house, I mean, what happened in second wave, what was a unique thing about second wave was the transmissibility. It was absolutely 100% of the family members were being affected. One person affected, the spouse, and all the children were affected virtually across every families. And that explains the sero surveillance reports that the children are also infected at the same rate as the adults. And so that it will predominantly affect the children is less likely. It may affect as we have seen this time. It's just that the children do not get sick and they do not get admitted, and death rates are very small among them. And so it may continue to be in the same spectrum. There may not be a change in the spectrum is what is most likely that we are anticipating.
Okay, thank you, sir. Dr. King already covered this presentation, but a little bit more explanation would be really appreciated, sir. The question here is, how long will post-COVID symptoms last? We've been having patients who have been complaining about being tired and fatigued for a long time, and hair loss, and they're not feeling their usual self. So they're asking, how long will these post-COVID symptoms last, and what can they do?
Yes, post-COVID symptoms is still is a problem, especially after the first and second wave. After the first wave, and now we expect more of these patients to come after this huge second wave that we have had. Generally, we are seeing patients with post-COVID symptoms lasting for a few weeks to a few months. We have also seen patients needing to be on oxygen for even up to 3 months after their infection. And So generally, on the average, I would say 6 to 12 weeks is what we see most of these post-COVID symptoms lingering on. And it is mainly to do with the persistent inflammation that is going on in there in the tissues. And the best way to combat this post-COVID symptoms is rehabilitation and, working on your, anti-inflammatory measures, good sleep, hygiene, having a lot of food that promotes anti-inflammatory diet. Yeah, so these are some of the few things. There are no medicines definitely that we can do that can be given. For lung scarring, it used to be a major problem in the first wave and first wave, we did use some steroids and medicine, but then we realized that most of these patients are getting well on their own. So even that was not necessary. Many of them got well, the lung scarring got better on their own. So it is just rehabilitation, conditioning, and some social and psychological support, diet, exercise, which improves this post-COVID symptoms.
Okay, thank you, sir. We just had a question from one of our viewers. I'll post the question for Dr. Samuel. The viewer says that they have just taken the COVID vaccine about 23 days ago, and they've been having a severe cough for 2 weeks now. So the question is, does the vaccine affect the lungs?
I would put it the other way. So if you have taken only one dose, it doesn't protect you against COVID infection. As of now, the understanding is your protection is after 2 weeks after your second dose. So you have taken the first dose, after 1 month, you have taken your second dose, and after 2 weeks after the second dose is when we expect protection. And any symptoms before that will have to be attributed to COVID per se. And you may be having a COVID infections which needs to be tested. COVID vaccine per se would not be typically giving you the symptoms of COVID, because most of these vaccines have been so designed that these are attenuated viruses which doesn't cause natural symptoms. The max that they cause is a usual fever, myalgias for a few days, and then you are okay. So any other infections normally would advise them to get them tested for COVID. Either they are COVID or some other infections. But vaccines per se, we haven't seen patients coming with respiratory symptoms per se.
Okay, thank you, sir. Since we're on the topic of vaccines, a very common question posted was, are vaccines safe? Should we take the vaccine?
So as I mentioned, our vaccines have gone through the different phases. So the first phase is the safety phase. Second is the efficacy phase. Now, when we say safety, there are two safety things that we look at. We look at safety in a short term, and we look at safety in the long term. And that's why any vaccine which actually is recommended by the FDA to be used is only after at least minimum 5 to 10 years, because you need to see the long-term effect of the vaccine. So for COVID, we do not have the long-term effects. So we do not know what are the long-term effects of COVID, because we haven't had time to see for that. In a short term, we have not seen any major worrisome side effects. There were talks about thrombosis, but the number of people having blood clots is almost same as a general population. So it's difficult to attribute that to the vaccine per se. And complications in the heart and all those things, the numbers are too small to say that it is being caused by the vaccine. Keeping in mind anything foreign that we introduce in our body may have some issues and effect short term or long term, and those may be sometimes difficult to pick up. And if it is small in numbers, most of the time we tend to ignore it or say that it happened as a coincidence, not really as a part of vaccine. So some of those questions will always remain unanswered. we cannot categorically say that it's absolutely harmless. And so one would always tend to go the natural way. And if by natural ways we are able to take care of our health and protect us from infections, it makes absolutely reasonable sense to do that, because proving something is always difficult, and not having proof does not necessarily mean that it's absolutely safe. But in a pandemic kind of a situations, we do not want you all to be going home from here thinking that we are telling you not to vaccinate. But uh, 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 you can get natural infections, and that will also protect you against the COVID is also a possibilities. And if you are generally healthy, young, the chances of you having a severe infections or death is small, very small in this group. So it's a very individual and a personal choices that we would want you all to make. We would not use this forum to tell that we are discouraging you from taking a vaccine. So I think we need to be very balanced in how we make decisions, but it should be something that each one of you have to weigh for yourselves, look into the evidence, and make a decision for yourselves rather than making it to blanket statement for everyone.
Yes, thank you, sir. Uh, a question for Dr. King. One question was posted: how can we improve our lung function post-COVID? What are some easy ways we can do to help improve our lung function?
Yes, COVID does cause a lot of lung scarring, as I said earlier, and this decreases your lung function, the lung capacity, the amount of air that you can take into your lungs just does decrease after the scars. And what we did not know earlier, that after the first wave, we thought that these scars would be permanent, or these scars would be progressive, like we see in certain other diseases, like tuberculosis, where the scars kind of remain permanent even after the person is healed. So we kind of expected the same thing even in COVID, that these scars would probably remain even after the disease. But what we saw was quite amazing, that after 3 to 6 months, many of them who had very, very bad scars in their lungs just improved over time without any medicines and just on their own. So really, you don't need to do anything special. Just follow a healthy lifestyle, deep breathing exercises, conditioning your lungs by doing deep breathing exercises and light walking. It is important not to overstress yourself, because the body does become very weak, and there is a lot of deconditioning that has taken place. So gradually, as much as possible, try to get back to normal activity as much as you can tolerate. Breathing exercises do help, but eventually these lung scars, most of them, over 95% of them, do improve over time. That is what. So you really don't need to do anything special. Just keep a healthy lifestyle and follow physical activities and breathing exercises. It does improve with that.
Thank you, sir. One question on a chronic disease. This is for Dr. Samuel. The question is, why are people with diabetes, hypertension, heart disease, or obesity most susceptible to COVID?
Yeah, thank you for that question. If it is not now, it will be never. If we don't understand what an inflammation can do to our body, in COVID acutely, in chronic diseases chronically. So we are slowly trying to understand that virtually every disease has a basis which lies in the way our body reacts to it, and what we are calling as inflammation. So, I mean, many of you may be hearing this word inflammation. For us, it's a common term. Whether you understand what we are saying is, just to explain to you, is that our body has different cells which reacts to anything that it identifies as foreign and it mounts a reaction to it. The reaction can be of two types. One is if you find someone whom you hate, you just catch that fellow and you wrestle with him and you kind of pin him down. That's one way to fight. The other way to fight is whip out a gun and just shoot him. And so in a body, we have a very interesting way. There are certain cells which wrestles with these enemies, and there are other cells which shoots guns. We call this antibodies, are like bullets out of a gun when you shoot the enemy. So if your security person who is stationed outside your house, who is supposed to protect you against any enemies, if one fine day when you come home and the security starts hitting you or try shooting you, it is that kind of a disease which explains most of the diseases, be it diabetes, heart disease, high blood pressures, cancers, autoimmune or arthritis disease. Every disease has a basis in inflammation, what means how your body reacts to that. And in COVID, it is classical. In a very short time, we can see how your body reacts to this virus, and it is not the virus, but it's that inflammation that kills you, as King already mentioned that. And so it makes sense to ask yourself, what are the things that reduces inflammation in my body or makes my defense cells work in the right manner? And for that, we are using the word healthy lifestyle in a very broad way, but let me make it very specific. What a healthy lifestyle is in diet. Number one, in diet. In diet, what we are looking at is all raw foods, fruits, and vegetables are called antioxidants. They reduce inflammation. Any food that is processed and refined, they increase inflammation. If you take white rice versus if you take brown rice, you will see the difference. If you take wheat, broken wheat, wheat flour, or maida, that is the levels of processing. The more finer you make it, the more inflammation it does. So that means essentially you take the food as it is in nature in a very broad way. If you take the food as it is in nature, it reduces the inflammation. You do exercise, it reduces the inflammations. You are restful and peaceful, you are reducing your inflammation. You sleep well, as King mentioned, you reduce the inflammation. If you have a meaning and purpose in life which reflects on your spirituality, it reduces that inflammations. I mean, many of the people are so fed up hearing all these words again and again that we have lost the importance and the significance, but it is never like before that our understanding has become much more clear. So basically what we are saying is the chronic diseases has an inflammation in the background. The diseases predisposes to COVID infections that we saw as King put up that chart. And so all these diseases has a background of inflammation as the understanding of the disease. And so they only kind of make things worse when both of it works together. So I'm just trying to make it as explicit so that we understand. And these are things which is based on science and studies, which very clearly shows the connection of our diet, exercise, sleep, and stress having relationship to inflammation, which is related to all the disease that we are talking about, both short communicable disease, infective disease, and non-infective disease.
Thank you so much, Dr. Samuel. I hope question was answered. We have been having many more questions, but due to time constraints, we'll have to come to the end of our webinar. But I'd really like to thank you, Dr. King Kisku, Dr. Samuel Handstack, for your valuable time with us, for answering these important questions and also addressing important issues all of us are facing. And I hope this presentation has given us clarity as to how we can move forward and face this pandemic. I'm sure all of us have learned something very important this evening, and a better understanding of COVID-19 is paramount in prevention. Make an informed choice when you think of taking the vaccine. Know your risk factors and take precaution. Practice COVID appropriate behavior. this should be foremost. At Restoration Healthcare, we use lifestyle medicine and natural remedies to help in the remission of diabetes, hypertension, obesity, and many other lifestyle diseases. You can check our link and information on the Zoom chat and also on the YouTube description. And I really implore you to make the change you need to make with regards to prevention of COVID and healthy living. Stay safe, stay healthy, and may God be with you. Have a good evening.
Thank you.
Thank you, sir. Thank you, Dr. Kismet.
Thank you very much.